Liposuction has changed dramatically. New Vaser high-definition body sculpting has combined art with technology in reshaping, refining, and enhancing the human body. We spoke with plastic surgeons Dr. John Millard and David Broadway of BodyVolve Plastic Surgery in Denver, Colorado, to find out how this revolutionary procedure has transformed liposuction into an art form.
Liposuction, I think, has suffered over the last 30 years from two things: a lack of imagination and really a lack of technology that would allow us to expand or enable our imagination. What Vaser High Def has done through the enabling technology, the Vaser, has allowed us to do what once we only dreamed about doing: creating form, shape, shadows in the human body, really being able to pull out the best that we can be. For example, in a man, an athletic appearing body was defined over 400 years ago with Michelangelo's David. That muscular six-pack, those defined obliques, the defined male chest. We, as plastic surgeons, use that same template to selectively remove, yet leave some fat behind, in a way to enhance those anatomic structures on the male's body. We do the same thing on a female body. In a woman, it's more of a tube pack. We create definition between the woman's hip bones and the center of her belly to give that nice scooped out shadow that everybody likes between the bikini. As everybody, when you go to the beach and you see a woman laying down and you see that nice little, what I call airspace in the bikini between the woman's tummy and her hip bone, we actually work to create that with Vaser High Def in the female.
We asked Dr. Millard who is a candidate for this procedure.
Vaser High Def has a broad spectrum of candidates, and it's actually created a whole new group of patients that are coming to us. That being the patient that would not traditionally have had liposuction. For example, the person that works out in the gym, the man or woman, who spent the last 3 or 4 years working out 5 times a week, yet is not seeing the definition that they think they deserve to have. That's an ideal candidate, for example. At BodyVolve, we have actually pioneered some of the state-of-the-art anesthesia that allows patients to not have to go to sleep. We have worked hand in hand with our anesthetists to advance the anesthesia for this procedure as well.
The Vaser breast lift, I think, will add to what we've been doing in the past. I think it's going to evolve even more. With high definition breast surgery, we are not only just giving volume with an implant, but we're also trying to shrink wrap the skin to give some tightness to it, to bring the soft tissue back up over the implant to give a better look. We're also taking out fat simultaneously to define the lateral border of the breast, to give it a more youthful appearance, and to highlight the volume that the implant gives you. Typically we do this under IV sedation. It's done as an outpatient. A standard breast augmentation will take about an hour, hour and a half. The Vaser breast lift will add another 20 to 30 minutes to the procedure. The liposuction may add another 35 to 45 minutes. My determination of success is how the patients feel about it. And I know that we're giving them a better result than just an implant alone, and again without any additional scarring that is visible to other patients or themselves.
Vaser High Def allows the surgeon to be the artist, the patient the canvas, creating living, breathing works of art. This is where science meets art. If Michelangelo had been born in the 20th century and this procedure was available, I firmly believe he would have been a plastic surgeon.